Good afternoon, everyone, participants and the team of conference of Texila. Okay, thank you. Good afternoon, team of e-conference of Texila American University and all the participants who are listening my presentation. I am Dr. Madhumati Varma, working in Central Hospital Nampula as a consultant internist and diabetologist. I am also a third year PhD student of Texila American University. It is great for me to present my part of work of PhD in this conference. My topic of presentation is to see the effect of education of diabetes in controlling the blood pressure, urea creatinine and fasting blood sugar in the patient of OPD of diabetes in Central Hospital, Nampula. Introduction of this topic. We know that the global report of WHO is published in 2016. He estimated the 422 millions of the adult population is suffering from the diabetes, and it is increasing day by day. Now is 4 times compared to the 1980 in was 108 millions population of the diabetes. I am working in Mozambique, so I am focusing the patients and the study previously done in Mozambique. Mozambique is located in east coast of Africa, and there is about 274 and 700 people are suffering from diabetes, which is reported 2015 by IDF, International Diabetic Federation, in which there is a 716 patient is diagnosed complication of the diabetes. In the Mozambique, in the Nampula, generally we see in the OPD, the patients are obese, and there is a lack of knowledge of the non-pharmacological treatment, and they are has several complications of diabetes, and they believe in the traditional healers, which also gives the complication of the diabetes and difficulty in the management of the diabetes. Summary of my work is this. As you see, there is a patient of the diabetes in the OPD waiting, attending the education session. We have done 3 education sessions of the diabetes with interval of the 1 month in the OPD of diabetes, baseline, first follow-up and second follow-up, and prior to the each follow-up, nurse is noted the blood pressure, fasting blood sugar and urea creatinine, which is performed 2 or 3 days prior to the education session. When we did a statistical analysis, we found that there is a positive significant control in the all these parameters of diabetes. So the education is helped to control the diabetes, and the patient are waiting in the OPD to attended by the doctors. So what the problem is that the group of patients generally depends in the OPD. We have seen pharmacological treatment. Why is they are depending on the pharmacological treatment? Because there is a government is expending about $80 per patient of chronic disease, and it is free of cost. So the patient generally believes in the pharmacological treatment. They don't give importance to the non-pharmacological treatment, and as we know, the treating the diabetes is a comprehensive group of specialists should be help to the patient to reduce the complication and control of diabetes. So it was very necessary to study in this topic and see the what is the importance of the education to improve the lifestyle of the patient, including the diet, exercise, and the other modality to improve the control of diabetes and reduce the complications. So objective was it there to see there is a need to modify the lifestyle and improve the knowledge of the diabetes of the patient, so they can detect themselves a small little complication and when to present the doctors. And also there is a scene that the patient is not adherent to the treatment. They come 1 month they take treatment and they go away, and sometimes they left the treatment for 6 months because of lack of money or lack of awareness. So this also one of the objective to motivate the patient to be continuous treatment and reduce the complications of the diabetes. Method we were used in OPD, we have taken about 648 participants in a study. It is a clinical interventional study, and inclusive criteria in the participate in education session was that the patient should be the OPD of the diabetes in Central Hospital Nampula of any age, and they are willing to participate, and they agree to give a consent for the participate in the education sessions. And exclusive criteria, those patients are living far away from the hospital in the district and they have no difficulty to come back every month to follow, and they are not willing to participate in the education session. The educator group of educators we have taken in the education session was diabetologist, dietitian, psychologist, and physiotherapist and diabetic nurse. The diabetologist is given the brief presentation of the regarding the diabetes and definition of the diabetes, complications, and complications. Dietitian given the nutrition part, which is what type of diet and is essential for the patient of diabetes in the general groups, and psychologist given the diabetic patient how to cope with the diabetes and live normal with diabetes. Physiotherapist given the brief knowledge of importance of the exercise and the general exercise which is applicable to the all patients. Diabetic nurse also helped in the taking the data in initial stage, like taking a consent, filling the questionnaires, and noting the blood pressure and results of the blood sugar and urea creatinine. And also in the end she helped to educate the patient how to use insulin and the glucometer. The education session was done 3 times interval of the 1 month prior to start the OPD, and the OPD was Monday, Wednesday, and Friday. After the education session is done, 40 to 50 patients in the room because the non-availability of the big hall. First is given to the new patients baseline, and then in the first those patient is first follow, and after that those patients come for the second follow. There was
Madhu,
yeah.
lot of background noise.
Yeah.
Close the door of
Yes.
someone is shouting at your back. Lot of background noise.
Okay. Okay. Hello. I was explaining that there was all patients is given the baseline, first follow-up and second follow-up education, and there was no restriction of the patient to be attended one baseline, first follow-up, second follow-up, second times. And the results were noted, and all these results were analyzed in the SPSS 17 version software, and some graph is made on the Excel software. The descriptive analysis was done on percentage, frequency, and the mean value and standard deviation. As you can see, the systolic blood pressure and diastolic blood pressure in the baseline, first follow-up and second follow-up. The baseline, it was 130 by 71, which was reduced in the second follow-up 120.9 to 68.79. Also, you can see the blood glucose baseline is improved from 10.15 to the first follow-up is 8.89. Also, creatinine is also, you can see, that is reducing 3.62 in the baseline and 8.03 in the second follow-up. Urea is slightly decreased from the baseline 4.66 in the second follow-up, but in first follow-up it is shooted 4.86. Also done the analysis on SPSS, linear regression, ANOVA analysis, and post-hoc Turkey test, in which we have seen the compare of the first follow-up baseline, first follow-up and second follow-up are the independent variables, blood pressure, urea, creatinine, and the taken dependent variable is fasting blood sugar, which is also seen a significant result less than 0.005. I can go back also. So when we see the previous study is also showing the same results, and Molangol et al. 2009 also emphasized that the education is helping in the improvement of the metabolic parameters. Salinari Forte et al. In 2011 also shown that the diabetic education is helping to control the diabetes.
To conclude, yes. You have 3 minutes to conclude. Please conclude. 3 more minutes to go.
Okay. Okay. And also the Pereira et al. 2014 also shown that there is a education of diabetes helping in controlling the blood pressure and improving the knowledge of diabetes by the pre and post test of the patient. A conclusion is that each participant which is evaluated and taken the education of diabetes, their blood pressure, blood sugar, blood urea and creatinine is improved, and is shown statistically significant by the all the parameters. And indirectly we can say the pharmacological treatment is as much as important as the non-pharmacologic treatment. Non-pharmacologic treatment is also helping to improve. And one more thing is very important, that patient can get education and not implement in their lifestyle, is so that we have seen that those patients who is get educated, improve the knowledge, and applying all this education in their lifestyle, is results are positive. So in future study that we have done in OPD of Central Hospital Nampula, we can see in the emergency department, we can see in intensive care unit, we can see in other department, and also we haven't involved the family of the patient, because the family of patient is also very important to help them to control making the food and all these things. So in future we can do, and we can make we suggest to our Ministry of Health Mozambique to do a policies which can help to the patient in a hospital before they starting the OPD, a 115 minutes or 10-minute education session to improve the knowledge of the patient and is help indirectly to the control of the diabetes. This is my references. Thank you for attention.